Opioids are a highly addictive class of drugs that are commonly used to relieve pain. They can be prescribed by doctors to help manage chronic pain or to help patients recover from surgery or an injury. But as we've seen in recent years, the overuse and misuse of these drugs has become a major public health crisis. Prescription opioids such as OxyContin, Percocet, or Vicodin are some of the most misused drugs. People may start taking them for legitimate pain, but soon find themselves physically dependent, and the withdrawal symptoms can make it even harder to stop. People often turn to illicit opioids like heroin when they can no longer get or afford legal prescriptions, but the risks are much greater with street drugs, as the purity and potency can vary greatly. Many illicit drugs, including opioids and other drugs, are now laced with fentanyl, so you don't really know what you're taking. These can include drugs like Xanax, oxycodone, heroin, and cocaine, to name a few.
The misuse of opioids can lead to serious health problems, such as opioid use disorder, overdose, poisoning, and even death.
Opioid overdose is a serious and potentially fatal condition that can happen when a person takes too much of these drugs or takes something laced with fentanyl. If you suspect that a loved one is experiencing an overdose, we want you to be prepared to help them. The most common signs of an opioid overdose include slow, shallow, or stopped breathing, choking sounds or snore-like gurgle, pinpoint pupils, confusion, a slow or irregular heartbeat, cold, clammy skin, or blue lips and nails. They may even lose consciousness and be unresponsive to voice or touch. If you encounter someone who is unresponsive from a suspected opioid overdose, call 911. Time is of the essence in these situations, and every moment counts. Once you have called 911, lay them flat on their back. If you haven't already, check to see if the person is breathing. Then try to wake them up. You can shout their name, try to shake them awake, or make a fist and rub it on their chest. If they're still unresponsive, administer Narcan. To administer Narcan, remove the cap and insert the nozzle into one nostril until your fingers are against the base of the nose. Then press the plunger firmly to release the medication. Do not do a test spray before giving the dose. It may take more than one dose to revive the person. If they have not responded in 2 to 3 minutes, administer another dose in the other nostril. If they remain unconscious, repeat these steps every 3 minutes. Using Narcan on someone who is not experiencing an opioid overdose isn't harmful, so if you're in doubt, go ahead and administer the Narcan. Next, move the person on their side into the recovery position. Put their hands under their head and roll their knee forward to help them stay on their side. Be prepared for them to wake up abruptly and be startled and confused. They may go into immediate withdrawal and even throw up. They could also be irritable or restless, have an increased heart rate, or experience body aches, chills, or sweating. Be sure to provide comfort and support as best you can until emergency services arrive. Once emergency services arrive, it's important to give them all the information you have about the person's condition and any drugs they may have taken. If you are with someone experiencing an overdose and drugs are in the room, you are protected by Nebraska's Good Samaritan law. Under this law, people who seek help for themselves or others during an overdose cannot be arrested, charged, or prosecuted for possession of small amounts of drugs or drug paraphernalia. For more information about Narcan and other ways to help prevent overdoses, please visit the Stop Overdose Nebraska website.
For those who need it, help is available. Options include medication-assisted therapy, in- and outpatient rehab, counseling, and support groups. It's important for people to know that recovery is possible and they are not alone.
If you or someone you know is struggling with an opioid use disorder, don't hesitate to reach out for help. Together, we can work to combat this public health crisis.